Yeah, first of all, hi Sudhir. How are
Hello.
you?
Good. How are you, Dr. Naveen?
Yeah, I'm awesome, Sudhir. So, as you know, like we have been doing this video series, podcast series, where the main area of interest is to know various options we have, like
Hmm.
after BDS, because
Yeah.
conventionally we were told like there is either clinical practice or masters, and most of us are not aware of various options which we have after our dentistry or after our graduation. So,
Hmm.
keeping that aspect in mind, I've been extensively traveling, as I mentioned previously, trying to highlight certain areas or as options we have. And in the process, I'm really happy to hear from you. And so, you have done your master's in epidemiology and you're working as a lead epidemiologist. So, can you just briefly tell about yourself and which
Absolutely.
place you are from?
Firstly, I congratulate you and thank you for doing all this excellent work in connecting those dots for careers for all of the young graduates in dentistry, and not just dentistry, in any part of the medical field or
Thank you for that.
any field
Yeah.
in fact. Coming back to our discussion. So yes, we have conventionally we were restricted to either masters or clinical practice, and as the time passed, I mean the opportunities became really limited. And when we think out of the box, there are many opportunities around the world where you can explore and you can
Mm,
uh, really make your career of interest.
mm,
uh, at the same time you can make some living, at the same time you can be more responsible for the society in doing what you love.
yeah, yeah. No, one
In
doubt
that.
which I have is there. I'm sorry to interrupt. One
Yeah.
doubt which I have is those who actually plan to US. One of the main objectives they have, or those who are going for US have, is to pursue DDS and to get into clinical practice. But it seems you have taken a different path altogether.
So yes, it all initiated from my interests, especially at the Sibar Institute of Dental Sciences.
Mm,
In
mm,
we were uh, we were teammates in public health dentistry, and we did several health awareness campaigns.
yeah,
We also participated in Bapatla camp with Gopalam sir,
yeah,
and
I
it
do
all
remember.
inspired me so much. Uh,
Yes,
I mean,
yes,
I understand people are really interested in clinical dentistry, treating the people and going to that stem cell research, but at the same time, there is a lot of need for preventive
mm,
services across the world. There is a
mm,
lot of
mm,
need for making people aware of, you know,
yeah,
healthy lifestyles, and
true,
which
very true.
actually
Mm,
influences so much, and it will definitely reduce the risk of mortality to a
mm,
drastic extent. So which
mm,
is why I considered masters in public health as my you know
mm.
uh, graduate course, and I did it in epidemiology and biostatistics.
Okay.
Even in my master's university, I planned several health awareness campaigns. I was the health ambassador for the university,
Oh,
and we
okay.
gave
That's good.
several interviews. We educated several
Mm, mm,
students in the university
mm,
towards
mm,
their healthy lifestyles.
mm.
Then I got a contact from somewhere with the health department locally in the state of Mississippi, where
That's
I reached out to Office of Oral Health in Mississippi, and I got an opportunity as an intern in Office of
okay.
Oral Health, where I used all my experience back from India and Sibar
Mm,
here
mm.
in oral health, and they are really impressed with the way I plan activities or I coordinate
Yeah.
with individuals.
Yeah.
And I
So
understand.
I'm sorry again, before you proceed with the intricate details, I just want to introduce you to our users as well. Like, Sudhir is one of my juniors, and we used to participate in many camps during our UG level. And Dr. Suresh used to be our source of inspiration. He
Absolutely.
is currently working in Middle East. He also worked as head of the department in some colleges in India,
Mhm.
and yeah, because of his inspiration, what we're doing right now, it can be Sudhir, it can be myself, the kind of inclination that we have is largely because of the ideas or encouragement we got from our faculty, especially at our undergraduate level. And
Absolutely.
Sudhir, I just want to hear from you, like briefly, how was your journey after your BDS? Like, when did you apply for masters in public health, and what were the reasons? You briefly mentioned about the reasons why you chose this public health and stuff. So, how was the journey? Can you just give us a
So I
comprehensive
took
idea?
some time immediately after my, undergrad because I wasn't ready for heavy clinical practice. I
Hmm.
mean, I am not sure because,
Hmm.
it is intense because I mean, people used to work at least till 9 p.m. or 10 p.m. every
Yeah.
night. Even now they are doing it, and I'm like,
Yes. Yes.
uh, and at the same time, I wanted to do it for society I mean, I want to reach out to people. I want to
Hmm.
know what they are thinking of,
Hmm. Hmm.
not just sitting in my clinic and treating the
So
patient.
happy to hear that. Yeah. Hmm.
Yeah,
Hmm.
so when you interact more, when you educate more, when you
Hmm.
explore more, you get more information. And with that,
Hmm.
you can do some intervention and get things
Yeah.
right. So
Yeah.
that was my intention initially. And
Hmm.
obviously, flying to United States wasn't that, easy for me because of several financial constraints and
Understand. Yeah.
several rules here which which the country established in order to
Hmm.
for the international students.
Hmm.
However, I am glad that I could clear one by one and able to secure this situation or position here in the Mississippi State Department of Health. And yes, to all the viewers, I'm the epidemiologist team lead for the comprehensive cancer and diabetes programs in the state of
Okay.
Mississippi, working for
Okay.
Mississippi State Department of Health. I am in
Okay.
this agency since 8 years. As I told you,
Okay.
I am involved in oral health earlier, and later to
Hmm.
just to expand my wings,
Hmm.
I mean, I'm currently exploring several chronic diseases in Mississippi, like their trends and
Okay.
we have funding from the CDC, and we have
Okay.
several interventions planned across the state. I know it sounds really gross when I, especially mention about, I work for the state level program, but it is easy. It's not easy, but at the same time, it is possible, even in
Hmm.
India, even in
Hmm.
Andhra Pradesh, or even in Telangana. So the only way to eat an elephant is eat one bite at a time.
Hmm.
So step by step, we can
One
do
step at a
things
time. Yeah.
possible.
Hmm.
So that's what I feel about. And yes, I'm happy that I'm able to provide my support
Hmm.
at epidemiology level for the state of
Yeah.
Mississippi.
So again, let me get you back onto the
Go ahead.
aspect which I asked you previously. Like, so after BDS, because for sake of viewers, like they just want to know, like, to be in a position where you are today, to do what you're doing today. Like, what's the route map that we have after
So
bachelor's?
after
They
BDS,
applied
like,
for master's program, public health, right? It's of
yeah,
2 years
not
duration.
not necessarily public health. There are several areas where you can explore,
Okay.
either health administration or health
Okay.
informatics or
Yeah. Yeah.
public health or biological sciences or any research oriented way.
Acha.
Anything,
Hmm.
whatever you do, you will ultimately end up in reaching out to the public. If it is a research area, if it is a
Hmm.
laboratory research, you'll go to a PhD and you'll establish your
Okay.
lab and you will do some
Okay.
kind of productive work there. At the same
Okay.
time, if it is public health, if it is epidemiology like me, you will go to the population research, you will reach
Hmm.
out to masses, you will, do surveys, take feedback, and then plan several interventions.
Hmm.
And you
Hmm.
will break out the task into several minor areas, like you will see
Hmm.
where the intensity of the disease is highest, and
Okay.
then you
Okay.
will try to address that population that
Hmm. Hmm.
you'll
Hmm.
target with specific or tailored interventions for that
Okay.
particular population, and then that will
So,
make a huge difference.
so when you're
So
talking about prevention and intervention, previously before pandemic, all of these things were taken for granted. In fact, But after pandemic, people started realizing the importance of all these interventions, the preventive models which you're talking about. So now I have a question, like you're talking about Mississippi State and your contribution over there. So I'm sure you know this. In India, there is even much a greater need for this preventive and intervention kind of program. So what would you suggest? Like, do you have any plans to get back to India? Like,
Uh,
what's your
Absolutely.
take
There
on
is
that?
there is a real need in India in order to plan these preventive
Hmm.
measures or preventive
Hmm.
programs. I am really interested to collaborate if there is any social organization is planning about any
Okay.
preventive measures or preventive programs in India. And
Hmm.
during my time, like back in 2016, I mean, all these 8 years changed everything in India.
Yeah.
So in
Hmm.
2015, 2016, there are limited public health colleges or public health
Oh.
training opportunities in India. But now there are many, I feel there are many, especially I think there is one in Jaipur, and I heard that there is a public health university coming up in Hyderabad.
Oh, okay. Hmm.
So that's a good thing for us and for the younger
A good sign. Yeah.
generation to consider
Hmm.
public health as their career
Yeah. Yeah.
and make some difference in people's lives,
In
because
society.
I
Yeah.
because when you must have witnessed when we went to Gopalam sir camps, there are 200, 300 to 800 people, 1,000 people coming for for the medicines or the preventive care or the
Very true.
counseling
Hmm.
sessions. So if that
Hmm.
is at the nuclear level, at a gross level, there are like millions of people who are really
Hmm.
really in need of those
Hmm.
uh,
Hmm.
prevention programs, especially in
Yeah.
India. So I would love to, I cannot say come back, but I would love to come back. But if there is a right opportunity and right time, I would not hesitate to support
Hmm.
and serve my motherland as well.
That's really nice to know. And see, as you said, like based on your conversation, like what I've realized is those who are inclined towards serving society on a larger scale, those who are inclined towards these preventive modes of treatment. Of course, yes, what you're doing, the route which you have chosen seems very much justified. But what about living? Like how is the earning potential over there? Because when students come to US, they even consider this factor of earning, right? So, what's your
So,
take on that?
so in any field, earning is really difficult.
Hmm.
There is no cakewalk to earn millions.
Yeah. Yeah.
So even in public health, there is a considerable strain, stress and strain in, careers. At the
Hmm.
same
Hmm.
time, it's not the worst.
Okay.
Because when
Yeah.
I initially started my journey to United States, and people were not that encouraging towards public health, there is no future, there is
Yeah.
no
Yeah.
career, and I'm like, okay, let
It's
me
not seen
try.
as a lucrative career, right? Yeah. Hmm.
Let me try. So whenever you have the potential, whenever
Hmm.
you are able to reach out to million people, or whenever you are able to do certain research which influences the system or which can show some great results, people
Hmm.
will
Hmm.
take you and keep you in their company.
Yeah. Yeah.
So
Hmm.
we want to develop that skill of analytical thinking and targeted interventions for the populations, where we will use our analytics epidemiology
Hmm.
principles
Hmm.
on them, and then giving out a productive outcome,
Hmm.
which
Hmm.
is when you will be identified. At the same
True.
time, coming to a local, I mean, individual level, yes, it is not that high paying job, but at the same time, it is not closer to zero. You get you get enough for living. At the same
Yeah.
time, you will be able to explore more. You will be exposed to several states, several countries, epidemiologists.
Hmm.
You will be open to participate in state level, national level, and international
Yeah.
level
Hmm.
conferences, where you
Hmm.
will be able to present your studies, present your
Hmm.
research, and
Hmm.
interact with people.
Hmm.
Get in
See
touch
the
with
world.
the
Yeah.
other local, you know people, wherein you can abstract or you can get some advices and make some connections,
Hmm.
which
Hmm.
is a healthy atmosphere in public health. But at the same time, when I shared my experience of public health, and when I shared my experience of three-tier public health system in India, people here
Mm,
are really surprised. India has
mm.
got the real best public health system, but at the same time, I am inside me, I am worried like it is not being, implemented in a right way.
Implemented, yeah.
So we have several resources already
Mm,
established, and
mm.
there are several
Models are there.
committees,
Yeah.
such as
Mm,
Srinath Reddy committee. When we were in undergrad, they gave several guidelines, and there is public health universities in, I think, in Jaipur. So there
mm,
is a
mm.
great university. So there are several opportunities in India as well for people who are interested in public health. But at the same time,
Mm.
if anybody is also trying to explore some
Yeah.
opportunities in the United States, I mean, it
Yeah.
is land of immigrants and land of opportunities as well.
Opportunities. Yeah. So American dream. Are you living your
America is
American
no more
dream?
a dream now.
Hmm. Yeah, and one more thing, Sudhir, like what I've noticed is like, as you already know, in our curriculum in public health dentistry, epidemiology, all these chapters or topics are considered as burden. In fact,
Really?
I mean, in general, students' perspective, there is no real interest in learning what these topics are. It can be tests of significance, it can be statistics, it can be epidemiology. So, to all the students who are watching this video, like, what would be your message? Like, why should they choose public health as a profession? How would you justify that? Because, as in your own words, it's not financially lucrative, but still, I got some answers from our discussion, right? Professional fulfillment, all those things. But still, I want to hear from you. Like, what would be your message to all those who are aspiring for a career in public health, be it in US, India, or anywhere in the world?
So two things. What I feel is one should be socially responsible.
Socially
So
responsible. Mm.
the moment we considered BPC or the sciences as our 12th grade course, we decided
Mm.
that we will probably become a doctor. At least 90% of them wanted to
Yeah.
become a doctor. Why
Vast
do you want
majority
to
of
become a
us want to be
doctor?
a
You
doctor.
want
Yeah.
to
Mm.
serve people, right?
Mm.
Nobody chose BPC just to make some money, right? Just to do a business, right? So they want to become a doctor and then get a good reputation.
Mm. Mm.
And when you have good reputation, your life will be comfortable. That's the
Yeah.
reason. But at the
That's the
same
expectation.
time,
Yeah. Mm.
when you are a doctor, you are skilled in treating people.
Mm.
You are skilled in treating people physically and mentally.
Mm.
You are
Mm.
skilled in motivating people, right?
Mm. Mm.
So again, when you come to your undergrad, like MBBS or BDS or pharmacy or anything, you are committed there to do some certain influential change in the
Mm.
healthy lifestyles or health of society.
Society.
When
Yeah.
you are committed there, you have got to keep your commitment
Mm. Mm. Mm.
by not just establishing a clinic, or
Yeah.
I
Yeah.
mean, I cannot tell this, but even DDS, people crave for it for their lucrative, paying
Yeah. It's
potential.
understood.
I understand
Yeah.
money is
Mm.
important, but
Mm.
not
But it's
just
not
money
everything,
is
right?
important.
Yeah. Mm.
So,
Mm.
I mean, even considering DDS is a good opportunity, good career line, but at the same time, once you are DDS in United States, consider social activities or social health activities, or
Mm.
connect to public health. When you're
Mm.
connected to public health, when you're connected to society, when you're connected to the society, you're already doing your promise.
Mm. Mm.
So
Mm.
I would definitely encourage people to consider either public health or make sure they are doing some kind of social health service at their own level in order to promote health and healthy lifestyles among communities, because that is the real need of the society. Especially in a way, I should thank COVID for making aware of who an epidemiologist
Yeah.
is, who a data analyst person
True.
is.
True.
So before which we used to really struggle hard to, what do you do? I'm an epidemiologist. What is that? So So now people are getting it, I work for
Yes.
healthcare sector. What is
Understanding
that?
the value of it. Yeah.
And
Mm.
even I wish there are some government-based campaigns that needs to be coming up in India as well for promoting public health across
Mm.
the country.
Mm.
And I understand there is a Ministry of Health and there are some things going on, but at the same time, it needs to be revolutionized in a very big
Yeah.
level in order to reach out to everybody. I know
Mm.
it
Mm.
takes time, but it is not impossible.
Exactly. It takes time, but it's not impossible. Good, 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 Sudhir. Happy to hear that. And finally, before we conclude,
And
I'm
especially, I want to add one more thing. When we are with our peers, when we are with our teammates, we
mm,
usually keep comparing with our friends.
yeah, yeah, that happens.
Up to
Yes.
10th standard, you can compare your score. Up to 12th standard, you can do it, but not after,
There are
you
always
got
these
into
comparisons
careers,
happen.
because one can be a pilot, one can be a farmer, one can be an
Mm.
epidemiologist, one can be a practitioner, because everybody have their own uh, line
Role in
of
society. Yeah.
career, their
Mm.
own,
Mm.
destiny.
Mm.
But we can compare just to get inspired, but not to feel bad, because we got to do what we have in our hand. We got to
Exactly.
be happy with what we have in our, at the same time aim for a better tomorrow.
Mm. Mm.
So that will help us in, leading a purposeful life, or not a
It's true.
comfortable life. Life cannot be comfortable for everybody.
Again,
But
comfort is a state of mind. It's all about one state of
exactly.
mind,
So
right?
when you're
Yeah.
when you are comfortable at work, when you are comfortable at,
Mm. Mm.
at your service, you'll be very happy
Mm.
person.
Mm.
Ultimately, what we want in life is being happy.
Being happy. Yeah.
Uh, Other than that, I would think there is nothing else is needed in life.
Yeah. I completely agree with you in all these aspects of it, because that's a realization for me personally and professionally as well. Money is necessary, but it's not everything. To an extent in market economy, money has a role, but it's not everything. But unfortunately, most of us keep running behind it, sacrificing our own likes
Yes.
and passion as a
Yes. Quality
consequence. As you
lifestyle is
said,
very important,
yeah,
especially when,
professional fulfillment that we achieve in the process makes all the difference, right?
yes, what is like academic excellence with social commitment.
Social commitment. I'm glad you still remember
Of
that.
course.
Yeah,
Yeah.
good,
And
good. Yeah.
that's it.
So
And if you have more
that's good.
questions,
So
or
if anyone is planning for such a programs, or those are planning for this masters in public health, or
please,
maybe along the lines which you are in, then we'll definitely ask them to get back to you through mail
please
as per your
definitely share
convenience.
my email
Yeah,
ID to them.
yeah,
Once they email
yeah.
me,
We'll
I
do
can
that.
reach out to
Yeah,
them with
because
my
as you said, we need
contacts.
more people who are actually inclined towards this profession, thereby making a real change in society. Especially the preventive models you're talking about, the intervention models you're talking about, they are the need of the hour, right?
Absolutely.
So thank you so much, Sudhir,
So
for your time.
definitely,
Anything else from your side? Concluding
um,
remarks?
I mean, as you said, like, please give my email to whoever is interested, or at the same time, I congratulate everybody for considering health as their career,
Hmm.
and
Hmm.
appreciate them, at the same time urge them or plead them to consider public health, at the same time consider the health of their society for a better living. We should live, we should also let others live. So so let's together encourage public health and make the positive change in the healthy lifestyles of individuals across the world. Thank you, Dr. Naveen.
Awesome. Awesome.
Thank you,
Awesome,
sir.
Sudhir. So inspiring interacting with you. And I'm really glad for the time you've given. And hopefully, this video will reach more and more people and will help them
Absolutely.
rethink about their career options. And all the very best for all the things you do. Super proud of you.
Oh, thank you, and proud of you. Proud to be a dentist.